The debriefing process is an essential part of medical education and training. It allows the individuals to discuss their individual and team performances. Thoughts on the case?
That was kind of intense. I was glad that Peter was there talking to the dad because I was totally like looking at this kid not breathing. And
I was glad Evelyn was there to say, let's get some backups before you throw that tube in there, maybe get some medication.
To identify strengths and weaknesses.
You know, Joe's constantly explaining to the mom, going through his thought processes, and it's important to speak out loud so that the whole team knows what you're thinking so that they can be on your same page.
And to develop performance improvement plans for their next medical encounter.
So we're doing chest compressions. This is one of those things that you talked about, maybe some things took a little while to happen. So we know VFib. What sort of stuff could we have been doing in the meantime? So shocking, yeah. That was probably the main critique I have of the code.
Debriefing is really a facilitative process. It should not be primarily an instructional session. One of the best ways to do this, and it takes a lot of discipline, is to minimize your own talking and maximize your listening.
I think our biggest mistakes were probably not recognizing the VTAC as soon as it was up, and I'm guessing it was there for a while.
Well, I
Usually
heard
there's
like
beeping with
all
VTACs,
three of you guys
right? You know, there's
say
no
that
audio.
this kid does not have a pulse, but no one did anything.
He had a brachial pulse for a long time when people were concerned, because he never had femoral pulses from the beginning.
You want to get them to teach themselves how to manage the problems.
One of the things that Evelyn said that I think was really useful is Nathan, she's like, he's running the case. He should be looking at the monitor instead of having to look both ways. So he should have been in the corner, which is a small thing.
That's true.
But I think that would have helped.
Regardless of the debriefing method you use, the elements are the same. You want to gather the information from the participants. You want to provide time to analyze the performance. And then you want a summary at the end.
So gather. So you do a case, you guys are done your case, you've watched your group do it, you bring them back here and you sit them down. And now you want to gather data. I'm not going to be the data gatherer. Let the learners be the data gatherers. So say, okay, everybody sits down, they go, it's the usual response. It just is. It's almost, it's like clockwork. They all just sit down and go, oh my God. And you say, how did it go? What else happened? What else can you add? Let them be the ones to direct the data gathering.
We initially started CPR and the patient was still breathing, and we had him on the mask, and then we started to prep our intubation equipment. We didn't have anybody who was bagging the patient then, and I had tried to designate myself ahead of time as like being able to stand back and make decisions about what was going on. But then we needed somebody to bag the patient.
They almost all the time will gather all the data that you want them to gather. So now let's analyze it, okay? Use the video for maybe one or two of your learning objectives, and then whatever you wrote down while you're watching the case.
So what was the first rhythm that, once he kind of crumped, do you guys remember what the first rhythm was?
The first rhythm I think was asystole.
Sometimes it's hard to tell on the thing. We'll see if we can pull it up here and then we'll see what you think.
As you're listening, what you're trying to do is to get the learner to unpack their thoughts and verbalize their thought processes.
Oh, stop it there. What does that look like, actually? Yeah, that's actually more. It's hard to tell once you start doing compressions, but that was VFib.
In this way, you will learn a great deal about whether they observed what you observed and whether they came to the same conclusions that you did.
Okay. All right. So what's not right here? You guys are doing a great job, but something's not right. What's not right? Leave it open-ended. They'll actually answer the questions themselves. And you'll add in sort of the technical pieces. If they don't quite know what the right thing is to do at this point and they can't get it, then that's your job as part of analysis. Let's talk about the bagging. Where are you bagging from? Behind them. Where's the bagging going on before? On the side. Can you actually get a good seal when you're bagging from the side?
No.
The answer is no. It's easier in pediatrics to get by with this because you can really get your hand around the mask. You can't get away with this in adults. This is a problem. There's a huge air leak. Okay, so now they're not being ventilated. The bag is made for the patients here. You got a bag in parallel. That's the only way you'll get a good seal. And then summarize the objectives. Say, okay, you guys did great on these things. Just keep in mind these 5 things, whatever those learning objectives are.
You know he has an ST elevation, let's just get the pads on him before we're in this situation. Let's get the crash cart nearby just in case he tanks.
Yeah.
So what are the drugs in the algorithm for VFib? Epi's one of them. Vasopressin, which can take the place of either your first or second epi. Make sure the EKG's
Yes.
first thing though. First thing, chest pain, EKG. Obviously CPR, 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 which I think you guys did actually very well.
Getting the most out of your debrief requires several elements. Probably the most important and overarching one is to be positive and diagnostic at the same time. This is not as easy as it seems. It takes time, practice, and a lot of discipline. Don't dilute the process by having too many learning points. Focus on 2 or 3 key things that they have to get right in the scenario. A general rule of thumb with respect to the length of the debrief is that it should be about as long as the case, but optimally it should be long enough to discuss the learning objectives, clarify questions about the case, and address the concerns of all the participants to their satisfaction. Work hard to bring everyone into the discussion. Facilitative questions help you to provide a non-judgmental account of what you observed. Be sure to acknowledge variations in practice styles. Make sure the observers are allowed time to provide their input. Their observations are often the most unbiased and complete because they are not burdened by actively managing the case. Make sure you direct questions to the quiet individuals. You'll be surprised at what they know and what they saw. This enhances development of shared knowledge structures among the learners. This has been shown to have a very positive impact on team performance. Address dangerous actions. This is one of the most important parts of a debrief. You want to change behavior before it becomes imprinted and part of a learner's practice pattern. Knowing when to provide instructional content is an art and a skill. Try to redirect the discussion to focus on the learning objectives when you detect that all the learners have an important knowledge gap.
You know your rapid sequence drugs for adults, just kind of know them for your kids. So what's the dose of Sux? Do you remember?
1 per kilo.
Yeah, a little higher so 1.5 per kilo. Lidocaine's what?
1 to 1.5 per kilo.
Yeah, 1 to 1 per.
Have participants summarize and verbalize the lessons learned at the end of the session. This helps to solidify the learning points. In addition, have the participants verbalize an improvement plan, as this will give them something to take home with them from the session. One of the most important things that we do at the beginning of every debriefing session is to let the learners know that we're going to be providing them with feedback. And while it may not always be complimentary, it will always be constructive and framed in a way to help them improve their practice. Use a debriefing framework that you're comfortable with and stick to it. Emphasize and redirect the discussion to focus on the learning objectives. Make sure that you use the video in the debriefing session. It is one of the most effective ways to drive home your learning points. Remember that debriefing is primarily a facilitative process, but the skillful debriefer knows when to inject instruction. If you concentrate on minimizing your talking and maximizing your listening, you will become a more effective debriefer. One of the key points to remember is that the students are vulnerable, and you have to acknowledge this in the debriefing session. If you do, they'll open up to you and feel like they're free to learn. If you do this, your training will be more effective, their practice will improve, and they will want to come back and participate again.